My feet hurt all the time. I need these fixed. I can't live with it anymore, not for the rest of my life. I think when I look at my toes, I won't, feel sad or depressed or grossed out.
Like many of you ladies watching, Margarita loves wearing high heels, but found herself frustrated that she couldn't fit into her own designer shoes, so she decided to take extreme measures.
My feet hurt all the time. My toes, everything. It's painful. These are my feet, and as you can see, both of these toes are significantly longer than my first. They're just kind of freakish, I think. I hate them. But now that I've been working in corporate, you like to wear heels. This is something that I would just love to wear all the time, but I can't. At the end of the day, I take them off and it's just like this, big release, and then the pain starts. I need these fixed. I can't live with it anymore. I can't do it any longer. So here we are, the big day, Dr. Sadrieh's office. I'm gonna have my toe shortening surgery.
Margarita, how are you?
Good.
Good to see you. Welcome back.
See you.
How you doing?
I'm well.
So what we're going to do is we're actually going to adjust the length of the toe to the right length with your foot. All the incisions will be hidden. You won't have any evidence of surgery. It is not a cosmetic procedure because it has a mechanical component to it. We'll shorten the first and second toes and straighten the fourth toe from underneath so they're nice and lined up. So this is our incision. Now this part of the toe procedure is kind of frightening a little bit for people, but we're going to dislocate the toe. This is a sagittal saw. That's not smoke, that's powdered bone. You can just see the immediate result of bone removal in one swipe. You see the difference? It used to sit here. Now it sits here. So now let's get our implant ready to go. There you go, you hear that? That's the sound of success. Now, we're gonna stitch her up and she's gonna be done. Cool, huh?
I feel surprisingly, really, really good.
So Margarita's here, and she's getting applause because no one in the audience can believe what she just went through. She's here 4 days after this very controversial operation, along with her surgeon, Dr. Ali Sadrieh. So we're all watching this, and everyone is putting their heads down, pretty graphic, and this is all in the name of wearing high heels.
It's all in the name of wearing high heels because they hurt, they're uncomfortable, they stick out, they don't look good. There's a couple of reasons that these patients come into the office.
So what were you doing there?
What we did is we shortened the toe. We took a piece of bone from the proximal phalanx, this bone right here, on the toe, and we took a piece of bone off, and we shaved another piece of bone off, and we shortened the length of the toe.
Did you fuse those two bones together?
We fuse those two, and that's a standard procedure that we do regularly
Bone
in foot
fusion.
surgery, except this is very unique because the patient doesn't have to have a pin in their toe. The traditional way to do it requires one of these devices. This is what's normal, and this is held in the toe for about 6 weeks.
To keep those bones together.
You got it, and we do it differently with this device.
And Margarita, I'm all for women looking good and wearing nice shoes, but why would you go to this length?
I, like all women, love fashion. I love shoes, sexy heels, peep toes, and I can't wear them because of these long, ugly toes.
You just couldn't fit right in, and it was very painful.
It hurt too. To me, this surgery isn't controversial. I mean, Dr. Sadrieh's he does this all the time, and if there's a solution to this, I'm going to do this. And
So it's functional surgery, but she's going to get a big benefit as far as wearing the shoes that she wants to wear.
Yeah, the toes are going to look great because they're not going to stick out of the shoes. So they're not going to be bumping up against the tip of the shoe. I haven't met a woman yet in the duration of time that I've been doing this procedure that buys the right size shoe because the toes are longer than they want, so they crown into the tight shoes.
So let's have you unwrap, and while we're doing that, I want to take a picture of your left foot before the surgery to show everyone what you were dealing with. And primarily focus on the second toe there, which is next to the big toe, how it's longer than any of the other toes. And now I want to look at an x-ray before the surgery as well as after the surgery. And if you look closely, you'll see how the first and second toes now line up perfectly.
Right.
And there are the two screws in there that previously weren't there. So I agree. You know, ultimately, if you choose to do this, it's not controversial for you.
No.
But there are risks to any surgery, infection.
Absolutely, absolutely. And this is one of the things that we have a conversation with in the office with patients. It's very important to understand why we're doing this, if it matters that much. And what I've done is I've reduced the risks by providing an environment that it's under local, so all the anesthetic risks are gone. And as long as the patient keeps the foot dry for 2 weeks, there's really no infection risk because we give them antibiotics as a prophylaxis. So across the board with this
infection is
device,
not a problem, even though that you're leaving the screws in there?
once the skin is healed, we're safe. So that's about 10 days, and we're golden from there on. It's been quite a remarkable procedure in the last 4.5 years of doing it. These patients have done very well. This is a little bit of dry blood on the dressing, as you can see, which is normal. We want that, actually. Dried blood is good.
For shoes.
In a few weeks, definitely.
And you
I'm
haven't
going to
seen
be
this
there.
yet, right?
This is the first time I'm going to see
So are you
my new
anxious?
toes. I'm really excited
That
to
was
see this. I mean,
very nice surgery.
Now,
Thank you.
Maybe they didn't enjoy it, but
I appreciate
enjoyed
that.
it.
Thank
Very
you.
clean.
That means a lot.
Bloodless.
Thank
We have
you.
a number
We use
of
a tourniquet.
women
Thanks,
in the
sir.
front row wearing high heels. Would any of you ever consider this?
it's not that bad.
The cool thing is it's not painful at all. I mean, these patients, you know, the first day they might have some throbbing, some swelling, but after that, there's just no pain. She's walking after surgery, and 10 days later, she's in normal shoes. As soon as the skin is healed, I start ambulating the patient, because that early active range of motion is very important. Now, these incisions are hidden. That's the beauty of this procedure. Historically, in foot surgery, we use pins, which it was terrible. I never liked it.
So in the old days, incisions
hurt.
were placed
Right
on
on
the top
top.
of the
Even
toes.
now they still
now
are.
now you're placing them on the sides.
Yes. I started doing that because I didn't like my patients coming in.
Wow.
She's a pretty lady. She's got pretty feet. Her toes are too long. I didn't want her coming
Yeah,
back.
she had nice feet to
They're
begin
really
with.
cute. See
It's
that?
just that those two toes
Now, what you can
were
appreciate
a little
here-
long.
Now, what I want to know is, those toenails are perfectly colored still.
Like that? It gives you something good to look at during surgery.
That's impressive. So we're going to look at a picture of your foot beforehand, and I want to do a side-by-side comparison of what it looks like now, post-operative.
Wow. I
You're obviously happy.
so happy. I finally have cute toes. I can go shoe shopping like in a few weeks. Yes. Thank you, doctor.
So what we've got first of all, minimal swelling, as you can see. Really no blood on the toes themselves. The toes are nice and aligned, perfectly shaped. The fixation, you like that?
Beautiful.
The screws inside are holding the toes together. So the beauty is, once her skin is healed, about 10 to 14 days, she's back in normal shoes.
You're not planning on doing this toe, are you?
We're going to do this foot. I always do
You
one
never.
at a time.
Yeah, you can't do both feet because then they can't walk.
Yeah, I don't take that kind of risk for the patient. But
So doing things on women's feet is not a new thing, is it? I mean, it's thousands of years.
it really is. Dr.
Women
Ray.
have been trying to fit into small shoes,
Absolutely.
change the shape of their feet.
You know, the Chinese started it all. The emperors had a fetish with feet. It was actually I have books on this in the office. It was a sex symbol, and they would bind feet. These are
And-
adult shoes.
That is unbelievable.
Pick those up in China, and that's what they used to look like. An old lady wore
Just by
those.
putting it under compression
They
for a long period of time.
They start at the baby age, and they bind them really tight with tight cotton wraps, and the bones develop upside down, so they have small feet. It was a sexuality thing.
This man knows his feet.
Well, thank you for sharing your surgery, Margarita. We wish you the best of luck with the right
Thank
foot.
you. Yes.